Recently, you or your child was prescribed Enbrel. Enbrel may be different than other medications you've taken. Since it's a protein, Enbrel comes as a powder that needs to be mixed as a solution and then injected under the skin. This video provides you with step-by-step instructions on how to prepare and administer a dose of Enbrel. Many of you are probably quite experienced in the process of mixing and injecting a dose of Enbrel. If you have not yet had a healthcare professional explain this process, it would be very helpful to do so. Their instructions should help you feel more confident in your ability to mix and inject a dose of Enbrel. If you have any questions about this process, you can call Enliven Services toll-free. The line is staffed by bilingual registered nurses who can help answer your questions about how to prepare and administer Enbrel. Enliven Services will also assist you with obtaining reimbursement for Enbrel. Enliven offers a host of other free services to help you with your Enbrel therapy, including the Enliven newsletter series and other helpful materials by request, such as a Sharps container and travel cooler bag. To get the full benefit of treatment with Enbrel, you need to take Enbrel as prescribed by your doctor. If you have any questions or concerns, do not hesitate to call your doctor or Enliven Services and ask for help. To begin preparation, first unpack your Enbrel resource kit. For help with this process, you should refer to the instructions in the handbook or patient package insert. A needle disposal container or Sharps container should be close by. Take a dose tray of Enbrel out of the refrigerator and place it on a flat work surface, such as a table. Remember that Enbrel must always be kept refrigerated. If not, it will become unusable. It's also important to know that Enbrel should never be frozen. Next, you need to wash your hands thoroughly with soap and warm water. Throughout the preparation and administration of your dose, you should be careful to keep your hands, tools, and work surface as clean as possible. Next, peel the paper seal off the Enbrel dose tray and remove the contents. The tray should include 7 items: the vial of Enbrel, 1 pre-filled diluent syringe containing 1 milliliter of diluent, which is a liquid, a plunger, a 27-gauge needle in a hard plastic cover, a vial adapter, and 2 alcohol swabs. If these 7 items are not included in the dose tray, contact your pharmacist. Check the paper packaging on the 27-gauge needle and the vial adapter. If the wrappers are open, do not use the 27-gauge needle and/or the vial adapter. Return it to the refrigerator and call your pharmacist, or call Enliven Services at 1-877-9-ENBREL for assistance. Check the expiration date on the vial and syringe. It should show the current month and year or a future date. If the expiration date shown on either the vial or syringe has already passed, do not use them. Instead, put the dose tray back in the refrigerator and contact your pharmacist for assistance, or call 1-877-9-ENBREL. The final step before you start preparing the dose is to check how much diluent is in the syringe. You do this by holding the syringe so that the gray tip cap is pointing down. Check the markings on the side to make sure there is at least 1 milliliter of liquid in the syringe. If not, do not use the syringe. Return it to the refrigerator and call 1-877-9-ENBREL. Since Enbrel comes as a powder, it first needs to be dissolved in a liquid diluent. There are 2 methods for preparing the Enbrel solution, one for adults and children over 34 kilograms, or 75 pounds, and one for all other children. Adult patients or children over 34 kilograms, 75 pounds, on Enbrel should use the vial adapter method. The vial adapter is for using 1 vial of Enbrel solution for only 1 dose. You should not use the vial adapter method if you will be using the vial more than once. The freehand method should be used for children under 34 kilograms or 75 pounds on Enbrel who are using 1 vial of Enbrel solution for more than 1 dose. As will be discussed later in the video, the freehand method does not incorporate the vial adapter in the mixing procedure. The freehand method requires 2 separate needles, one for mixing and withdrawing Enbrel, and the other for injecting Enbrel. Ask your healthcare provider if you have questions about which method to use. Instructions for the freehand method of preparation can be found in the area of this tape with the purple colored band. We recommend patients requiring multiple doses from a single vial to fast forward to this section. For the rest of you, we will now demonstrate preparation using the vial adapter method. This section is marked with a green colored band. You should not use the vial adapter method if you will be using the vial more than once. Begin by removing the pink plastic cap from the vial of Enbrel. Do not remove the gray stopper or silver metal ring around the top of the vial of Enbrel. This can also be done by using the cap removal tool found in your Enbrel resource kit. If you do not have this device, you can get one by calling 1-877-9-ENBREL. By placing the vial sideways in the notch at the back of the top of this tool, you can remove this cap. Next, place the vial of Enbrel down on your flat work surface and using one of the alcohol swabs, clean the gray stopper. Once you have cleaned it, do not touch the stopper with your hands. This can also be done by turning your dose tray upside down and placing your Enbrel vial in the round space marked V. Use one of the alcohol swabs to clean the gray stopper. Once you've cleaned it, do not touch the stopper. Then, partially open the package that contains the 27-gauge needle by peeling apart the tabs. Set the needle aside. Next, open the package that contains the vial adapter by peeling apart the tabs. Then set it aside. Do not touch the spike inside the vial adapter. Take the plunger and slide it into the flange end of the syringe. Attach the plunger to the gray rubber stopper by turning the plunger clockwise until a slight resistance is felt. Next, remove the gray tip cap from the pre-filled diluent syringe. Do not touch or bump the plunger. Doing so could cause the liquid to leak out. You may see a drop of liquid when removing the gray tip cap. This is normal. Do not touch the syringe tip. Place the gray tip cap on your flat work surface. This can also be done by using the cap removal tool. By placing the tip into the round hole at the front of this device, pushing the button on the top, and pulling back on the syringe, you can remove this tip. Once the gray tip cap is removed, pick up the vial adapter with your free hand. Twist the vial adapter clockwise onto the syringe until a slight resistance is felt. Do not over-tighten. Next, you'll need to attach the vial adapter to the vial of Enbrel. To do this, hold the Enbrel vial upright on your flat work surface. Grasp the sides of the vial adapter and place it over the top of the Enbrel vial. Do not bump or touch the plunger. Doing so could cause the liquid to leak out. Insert the vial adapter into the gray stopper on the Enbrel vial. The plastic spike inside the vial adapter should puncture the gray stopper. The vial adapter should fit snugly. Once the vial adapter is attached to the vial of Enbrel, hold the vial upright on your flat work surface and push the plunger down until all the liquid from the syringe is in the vial of Enbrel. You may see foaming or bubbling in the vial. This is normal. Gently swirl the vial of Enbrel in a circle to dissolve the powder. If you use the dose tray to hold your vial of Enbrel, take the vial with the adapter and syringe still attached out of the dose tray and gently swirl the vial in a circular motion to dissolve the powder. Do not shake. Wait until all the powder dissolves, which is usually in less than 10 minutes. The solution should be clear and colorless. After the powder has completely dissolved, foam or bubbles may still be present. This is normal. Do not inject the solution if it is discolored or contains lumps, flakes, or particles. If all the powder in the vial of Enbrel is not dissolved, or if there are particles present after 10 minutes, call 1-877-9-ENBREL for assistance. If you're now ready to inject, it's time to withdraw the solution into the syringe. To withdraw the solution, turn the vial of Enbrel upside down. Holding the syringe at eye level, slowly pull down on the plunger and remove the entire 1 milliliter volume unless otherwise instructed by your doctor. For children over 34 kilograms or 75 pounds, withdraw only the volume of Enbrel that was specified by your doctor. Be careful not to pull the plunger completely out of the syringe. It is, however, normal for some white foam to remain in the vial of Enbrel. Before removing the syringe, you'll need to check for air bubbles. You can do so by gently tapping on the syringe to make any air bubbles move to the top of the syringe, and then slowly pushing the plunger up to remove the air bubbles. If you push any solution back into the vial, slowly pull back on the plunger to draw the correct amount of solution back into the syringe. Remove the syringe from the vial adapter by holding the vial adapter in one hand and untwisting the syringe counterclockwise with the other hand. As you do so, do not touch or bump the plunger. Place the vial of Enbrel with the vial adapter on your flat work surface. Next, you will need to place the needle onto the syringe. Continue to hold the barrel of the syringe. With your free hand, twist the 27 gauge needle with the needle cover still in place onto the syringe until it fits snugly. Do not remove the needle cover from the syringe. Place the syringe on your flat work surface until you're ready to inject Enbrel. Remember, your sharps container should be used for throwing away used syringes and needles. To find out how to select and prepare an injection site, fast forward to the gold-colored section of this video. Enbrel is also indicated for juvenile rheumatoid arthritis. Some of you have children for whom Enbrel was prescribed. The freehand method should be used for children who are using one vial of Enbrel solution for more than one dose. You should not use the vial adapter if you will be using the vial more than once. In the freehand method, a 25 gauge needle is used to mix the powder and the liquid, and when withdrawing Enbrel. A 27 gauge needle is used to inject the mixed dose. Please note the contents of one vial of Enbrel solution should never be mixed with the contents of or transferred into another vial of Enbrel. You should also never reuse a needle or syringe. Never use the vial adapter if you are using the vial more than once. Contact your child's doctor or pharmacist to obtain additional 25 gauge needles, 27 gauge needles, and empty 1 milliliter Luerlock syringes. In the following section, you will see how to prepare your child's dose. To prepare the first dose of Enbrel from a new vial, remove the pink plastic cap from the vial of Enbrel. Do not remove the gray stopper or the silver metal ring around the top of the vial of Enbrel. This can also be done by using the cap removal tool found in your Enbrel resource kit. If you do not have this device, you can ask to have one sent to you by calling 1-877-9-ENBREL. By placing the vial sideways in the notch at the back of the top of the tool and pulling up, you can remove the cap. Write the mixing date on the supplied mixing date sticker and attach it to the vial of Enbrel. Then place the vial of Enbrel on your flat work surface. Using one of the alcohol swabs, clean the gray stopper on the vial of Enbrel. Do not touch the gray stopper with your hands. Take one of the 25 gauge needles that you received from your child's doctor or pharmacist. Open the needle wrapper by peeling apart the tabs and set the needle aside for later use. The 25 gauge needle will be used to mix the liquid with the powder and for withdrawing Enbrel from the vial. Next, take the plunger and slide it into the syringe. Attach the plunger to the gray rubber stopper by turning the plunger clockwise until a slight resistance is felt. Remove the gray tip cap from the pre-filled diluent syringe. Do not touch or bump the plunger. Doing so could cause the liquid to leak out. You may see a drop of liquid when removing the gray tip cap. This is normal. Do not touch the syringe tip. Place the gray tip cap on your flat work surface. This can also be done by using the cap removal tool. By placing the tip into the round hole at the front of this device, pushing the button on the top, and pulling the syringe back, you can remove this tip. Continue to hold the barrel of the syringe. With your free hand, twist the 25 gauge needle onto the tip of the syringe and turn clockwise until it fits snugly. Take the 27 gauge needle from the Enbrel dose tray. partially open the needle wrapper by peeling apart the tabs. The 27-gauge needle will be used to inject the dose. Set the needle aside for later use. Hold the barrel of the syringe with one hand and pull the needle cover straight off. Do not touch the needle or allow it to touch any surface. Do not touch or bump the plunger. Doing so could cause the liquid to leak out. Place the needle cover with the open side up in the round space marked N in the Enbrel dose tray. Now you're ready to add the diluent. With the vial of Enbrel sitting on a flat, hard surface, such as a table, hold the syringe with the needle facing up and gently pull back on the plunger to pull a small amount of air into the syringe. Then insert the needle straight down through the center ring of the gray stopper. If the needle is correctly lined up with the center of the stopper, you should feel a slight resistance and then a pop sound as the needle goes through the center of the stopper. Look for the needle tip inside the stopper window. If the needle is not correctly lined up with the center of the stopper, you will feel constant resistance as it goes through the stopper and you will not hear the pop sound. Be careful not to insert the needle at an angle. This may cause the needle to bend or break, or will keep the diluent from being properly added to the vial of Enbrel. Once the needle is through the stopper, very slowly push the plunger down until all the liquid from the syringe is in the vial of Enbrel. Adding the liquid too fast will cause foaming or bubbling. Next, with the syringe still in the stopper, gently swirl the vial of Enbrel in a circle to help dissolve the powder. Do not shake. Wait until all the powder dissolves, which is usually in less than 10 minutes. The solution should be clear and colorless. After the powder has completely dissolved, foam or bubbles may still be present. This is normal. Do not inject the solution if it is discolored or contains lumps, flakes, or particles. If all the powder in the vial of Enbrel is not dissolved, or if there are particles present after 10 minutes, call 1-877-9-Enbrel for assistance. To withdraw the solution into the syringe, with the needle still in the vial of Enbrel, turn the vial upside down. Then, holding the syringe at eye level, slowly pull down on the plunger to the unit marking on the side of the syringe that corresponds with your child's dose. As the liquid level in the vial drops, you may need to withdraw the needle partially to keep the tip of the needle in the solution. Be careful not to pull the plunger completely out of the syringe. Also, it's normal for some white foam to remain in the vial of Enbrel. Before you remove the needle from the vial, check for air bubbles in the syringe. Gently tap the syringe to move any air bubbles to the top of the syringe. Then slowly push the plunger up to remove the air bubbles. If you push solution back into the vial, slowly pull back on the plunger to draw the correct amount of solution back into the syringe. Remove the needle and the syringe from the vial of Enbrel. Do not touch the needle or allow it to touch any surface. Next, place the 25-gauge needle back into the hard plastic needle cover in the dose tray and push the syringe down until the needle is attached. You should hear a snap when the needle is secure in the needle cover. Once the needle is secure in the needle cover, untwist the 25-gauge needle from the syringe. Then, dispose of this needle in your sharps container. With the needle cover still on, take the 27-gauge needle and twist it onto the syringe until it fits snugly. Do not remove the needle cover from the syringe. Place the syringe on your flat work surface until you're ready to inject Enbrel. Before we discuss injection, there are a few things to know about storing a vial that still contains a dose of Enbrel and then using it at a later date. Once you have administered the dose, you should return the vial to the refrigerator at 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit as soon as possible. If you use the dose tray to hold your Enbrel vial, place the vial in the dose tray into the refrigerator. The vial has to be placed in the refrigerator within 4 hours after you mix the Enbrel solution, or the remaining dose will be unusable. Once refrigerated, the Enbrel solution must be used within 14 days of the mixing date. When you're ready to use a dose that's already mixed in a vial, you must first check the mixing date on the label. If it's more than 14 days since the solution was mixed, you must discard the vial. Remember, never transfer the Enbrel from one vial into another and never mix the solutions of two different vials. To prepare a dose that's already in a vial, you'll require a number of additional supplies that were mentioned earlier in this section. You will need an empty 1 milliliter Luwaloc syringe, a 25 gauge needle, and a 27 gauge needle. Ask your child's doctor or pharmacist about obtaining these supplies. Now you're ready to prepare the body for injection. If you have any questions on preparing a second dose, call Enliven Services at 1-877-9-Enbrel for assistance. The next step is to select and prepare an area of the body for injection. There are 3 places on the body recommended as injection sites for Enbrel. These are the front of the middle thigh, the abdomen, except for the 2-inch area right around the navel, and the outer area of the upper arms. Rotate the site for each injection. For example, if you're using the thigh as an injection site, use the right thigh for one injection and the left thigh for the next. Make sure that each new injection is given at least 1 inch from sites of recent injections. It's also important to note that you should never inject into any areas where the skin is tender, bruised, red, or hard. Avoid areas with scars or stretch marks. Once you have chosen a site for injection, prepare the injection site by wiping it with a new alcohol swab. Do not touch this area of the skin again before giving the injection. Now it's time to administer your injection of Enbrel. Pull the needle cover straight off the syringe. Do not touch the needle or allow it to touch any surface. This may also be done by using the cap removal tool. By placing the tip into the round hole at the front of this device, pushing the button on top and pulling the syringe back, you can remove this tip. Take the syringe in one hand and with the other hand, gently pinch the cleaned area of skin around the injection site and hold it firmly. Hold the syringe like a pencil at a 45-degree angle to the skin, and with a quick, dart-like motion, push the needle into the skin. Once the needle is in, let go of the skin with the other hand. Pull the plunger back slightly. If no blood appears in the syringe, slowly push the plunger down all the way to inject Enbrel. If blood comes into the syringe, do not inject Enbrel because the needle has entered a blood vessel. Withdraw the needle and select another site for injection. When the syringe is empty, pull the needle out of the skin, being careful to keep it at the same 45-degree angle. After the needle has been withdrawn, you may want to press a cotton ball or gauze to the injection site for 10 seconds. Do not rub the injection site. If needed, you may cover the injection site with a bandage. For children only, if enough solution remains in the Enbrel vial for another dose, refrigerate the Enbrel vial after use. Otherwise, discard the Enbrel vial and any remaining solution. If at any time you become concerned about the administration and injection process or your body's reaction to injecting Enbrel, call your physician immediately. After you have administered Enbrel, there are still some important steps to complete. For your safety and for the safety of others, it is essential that you dispose of the used supplies and materials properly. You should never reuse syringes, needles, or vial adapters. Also, never recap a needle. Dispose of both the used needle and the syringe in a puncture-resistant sharps container. Do not remove the plunger from the syringe before disposal. A sharps container made specifically for disposing of used syringes and needles may be used. Do not recycle the container. Make sure that the top of the sharps container is closed tightly and that you store the container out of the reach of children. When the container is 2/3 full, ask your physician, nurse, or pharmacist for advice on how to throw it away. Local laws for disposing of sharps containers vary. It is important to follow all provincial and local laws regarding the proper disposal of needles and syringes. If you have any questions about the disposal of sharps containers, you can also call Enliven Services. It is important to never put the plastic sharps container in with other plastic items you recycle. and never empty the contents of your sharps container in order to reuse the container. For adult patients and children over 34 kilograms or 75 pounds, any unused Enbrel remaining in the vial should also be discarded. When you need another sharps container, you can obtain one from your pharmacy, or you may call Enliven Services for a free sharps container. The vials of Enbrel, vial adapters, and used swabs should be placed in the trash unless otherwise instructed by your or your child's doctor, nurse, or pharmacist. The dose tray and cover can be recycled. Should a needle become bent or damaged in any way, do not try to fix it or use it. Instead, call your doctor, nurse, or pharmacist, or 1-877-9-ENBREL. If you're planning to travel, you can remove the middle part of the cap removal tool by untwisting the purple top and bottom. Once the middle part is removed, the purple top and purple bottom can be twisted together to make the tool convenient for travel. When full, simply empty the cap removal tool into the trash. If you have any questions not covered in your Enbrel information materials, call your doctor, nurse, or pharmacist. You can also call Enliven Services at 1-877-9-ENBREL. That's 1-877-936-2735 for more information. Please see important product information enclosed in the dispensing carton for more information.